Hi, I'm Matt, and welcome to the Strong and Healthy Rehab channel, a place to discuss all things rehab. In this video, we will discuss what is called the Visual Analog Scale, or more commonly known as the pain rating scale. You probably all use this scale at some point or another. It's when you're asked to rate your pain on a scale of 0 to 10. Which 0 is no pain at all, to 10 being the absolute worst pain imaginable. You may wonder what this rating scale means and why we as physical therapists, or just your healthcare providers in general, ask you about it. Well, we'll get into that right now. Starting off, let's talk about what the VAS, or pain rating scale, is. It's a linear scale that has even spacing between each level that makes it easier to rate things. For the pain scale, it will show a series of numbers on a bar that increases from left to right, which left is 0, right is 10. And the rating of 0 means no pain or symptoms, to a 10 being the worst pain imaginable. There could be faces showing different emotions, from a happy smile on the left to someone crying on the right. It may even include a color scale, green on the left, which is typically considered calm, to red, which is more active. The use of the scale is pretty straightforward. You'll be asked to rate your pain upon this scale, and we're just typically looking for a number rating. However, some people want to use the other scales. You can do so based upon how you feel. I will tell you, as a provider, we will often have to convert this over to the number that corresponds to the facial expression or the color or wherever that you point. And the reason is insurance companies often want that number on it. So we're going to have to document that. Now, keep in mind, this just isn't limited to pain. You may be experiencing other things such as numbness, tingling, burning, whatever that your symptoms are. We want you to rate those symptoms. The biggest reason why we use it is because it's pretty versatile and easy to use and understand across different ages or cultures. Many people are familiar with a rating system that goes from very low to high. So, for example, rating a restaurant or a movie out of 5 stars. Many people understand 5 stars is very good. 1 star isn't that good. So with the pain scale, people can relate that same system, or they can visually see that one side looks pretty good, whereas the other side is a little bit more bad, so to say. We also use the rating to understand what you are feeling at different points. We often start with asking you to rate how you are feeling right now in the moment that we are seeing you. We then can ask you to rate your systems at different times, such as how would you rate your pain at its overall worst? Or when is the pain at its best or lowest? Or maybe at certain times of the day, we want to understand what your pain or your symptoms are doing. For example, how does it feel when you first wake up? Maybe when you get home from work or before you go to bed. We'll also ask you to rate your systems with doing certain activities or things, such as standing, walking, sitting, bending, or just whatever during the day. This lets us know not only how you feel currently, but also how you feel at different points throughout the day, or again, with those certain activities. Overall, this gives us information about what is going on with you and your condition, not only at right now, but at certain points. Additionally, it lets us know if you're getting better or not. So we use those ratings over time to understand if what we are doing is helping you and that you are improving. But if you're not improving, you're not getting better, well, we need to either change up the treatment that you're doing or refer you over to someone else. That also lets us know what we can do at certain points. If you come in and your pain is very high, say it's around an 8 or a 9, the main focus of what we're going to do that day is to get your pain down, get you feeling better. But if you come in over time and you're saying, hey, my pain is only a 2 or a 3, we may be doing more advanced things with you to help you reach your goals. There are a few drawbacks to the scale. It is easy to use, but it does rely on someone's ability to understand it and communicate their symptoms accurately. Someone may not understand that the levels are different either in that increasing or decreasing amount. It can just say, I have pain. I have pain. I still have pain. I have pain. And they're thinking of it more like a light switch. The light is either on or it's off. There's really no in between. That's difficult for us as your provider because by saying there's still pain, we don't understand. Is the pain the same? Is it more or is it less? Now, in those cases, a way to explain it is like your pain is like a radio. So the radio is on, it's still producing sound, but the sound can be very loud or the sound can be very soft, all while the radio is on. Additionally, someone could switch the scale, meaning they could think that 0 is the worst pain and 10 is no pain. Or they may use different colors to communicate their symptoms because that's how they feel. In those cases, it's very important to explain the scale on both sides so that, again, both of us understand how you and your symptoms are acting. There are some complications that sometimes arises with communicating how someone is feeling, and that can be due to cultural differences. A very common one is a language barrier. If it happens to be that neither the provider or the patient speaks each other's language or understands each other's language, and there is not a reliable translator, it can be very difficult to understand how the patient is feeling, and it can be difficult for the patient to express how they are feeling. We are often able to overcome this with the use of translation services that many companies do provide. And lastly, I'll bring this up. Sometimes people can exaggerate their pain just some. You've probably heard stories of it or seen it portrayed in a TV show where somebody's exaggerating their symptoms, saying that their pain is like a 15 out of 10, but they're able to walk and stand and do all these things without any visible issues. I will say it's a very, very small percentage of people who ever do that. However, there can be a lot of different reasons why someone could say that their pain is so bad. One is that they are experiencing the worst pain that they have ever felt in their life, and they are using that as a reference. So it may not seem like it's a big deal to you, but they've never experienced any sort of pain like this. So that is their 10 out of 10 pain. Also, somebody could be very scared about what's going on, worried that they're going to be like this forever, or they're going to need all these treatments, or they have some horrible disease or condition. And that's how they are perceiving how they're feeling, that it's very, very bad. In those cases, we will talk with the person and try to ease their concern and talk them through it. And it very, very often helps calm them down, and we're able to proceed with treatment. There you go, everyone. That is the Visual Analog Scale, the VAS, or the Pain Rating Scale. That piece of paper that's on the wall of the exam or hospital room that you're in that has the numbers and the faces on it. I hope that you get a better understanding of what it is and why we use it, which is to understand what is going on with you and your symptoms to provide you with the best possible treatment. Thank you for tuning into the video. If you enjoyed it, please hit that thumbs up button. If you have a question or comment, drop them down below. And please consider subscribing to the channel, because all this information that is provided is to keep you strong and healthy.